Nowadays, most of us are suffering from cough, sore throat, and nasal congestion. These symptoms, you usually see them when the weather is transitioning from summers to winters. That's because of the dryness in the air that leads the germs to get attracted towards our nasal and respiratory tract. This is termed as common cold or upper respiratory tract infection. 85% of these cases are due to viruses such as rhinovirus, coronavirus, influenza virus, etc. Most common symptoms include sore throat, nasal irritation, cough, sneezing, headache, general body aches, and low-grade fever. Now the question is that when someone has these symptoms, what they should do about it. Ideally, these are self-resolving symptoms. They will go away by themselves. Generally, whenever a virus attacks you, it peaks rapidly over 2 to 3 days. You'll feel very sick in these 3 to 4 days, and by the 7th day, you will start feeling better. And by the 10th day, you'll be completely fine. In children, it might take more time, such as up to 14 days. Even after getting completely cured, it is possible that you might have some mild cough or irritation for up to 3 weeks, but that also resolves on its own. There is no cure for common cold. It is a self-resolving disease. However, there are some home remedies that can help you relieve your symptoms. For example, if you have a sore throat, then you can do gargles at home with lukewarm water and a pinch of salt 2 to 3 times a day. Also, you can drink plenty of water that will keep you hydrated as well as your throat. But please do not drink hot water. Normal room temperature water is enough. Hot water make your throat more dry and cause more irritation and maybe cough as well. A teaspoon of honey can also help you to soothe your throat. Also, you can suck on over-the-counter lozenges. For nasal congestion, you can either do steam inhalation or again, very easily you can find intranasal decongestant sprays in the pharmacies that can help you relieve your symptoms. For fever and general body aches, paracetamol or ibuprofen as needed will help. Please do not take antibiotics for common cold without consulting your doctor because antibiotics work against bacterial infections, and as I mentioned before, that common cold is because of viruses, not bacteria. So when exactly you should visit a doctor? If you have persistent high-grade fever after 3 to 5 days despite taking paracetamol, or if your symptoms are worsening after the 7th day, or you did not improve after the 10th day, or if there are any concerning symptoms such as difficulty in breathing or decreased responsiveness.